the care homes are closing largely due to financial reasons related to a drop in occupancy. Pre-COVID, they had only just opened and they were building up the number of residents. Following the COVID crisis, what we've seen is a significant reduction in the number of referrals. So we've now got around about 400 vacancies across the system. Technically, the council could step in. The issue there is that council's terms and conditions would apply, which would generally have a significant cost impact, roughly about £1 million per home. So it would cost about £2 million for the council to take them on at a time when we have a £23 million deficit. And that still doesn't address the under occupancy. At the moment, permanent residents are less than 60%. Yes, we have actually gone out to the market to ask for expressions of interest. We have had a couple of expressions of interest of people around running them as residential facilities. We've equally had a range of other expressions of interest to use them to support generally across health and social care. So once we've got that information, we can then look at what is in the best consideration for the people of Liverpool and for the use of those resources to maximise the investment that we've already made. I think that sometimes it's not necessarily well understood, but we do see in the care market, usually on an annual basis, 1 or 2 care homes will go out of business or cease trading for a variety of reasons. Last year, I think we actually had 4 in Liverpool. So unfortunately, people moving is an unintended consequence of those things. The current situation is obviously creating a lot more issues around vacancies, and it's certainly a bigger issue proportionately in the surrounding authorities across Merseyside, because we've got over 2,000 vacancies. But it's also something being experienced nationally. The LGA and government are now doing a survey to get a sense of what the impact has been across the whole market in the UK. It's a bit late, if anything, but at least they are now doing that. Obviously, the most worrying aspect of the whole of this is the impact on the individual residents, the families and the staff. We've put a number of things in place. We are working in terms of allocating a social worker and a dedicated team to support the residents and the families, and will help and advise them as they require on an individual basis. We're also putting in place support for staff in terms of helping them around their employment opportunities, linking them into various schemes that we have in Liverpool. And depending on what happens with the homes, whether there is either another provider or their homes, I'm pretty confident will still be used to provide some health and social care service, we would be negotiating that the staff are also considered first in terms of any future employment.